In this video, we're going to go over what Medicare does not cover. Now, I get all the time, Alyssa, oh, does Medicare cover this? Does Medicare cover that? It's better just to ask the question what it doesn't cover. And then towards the end, I'm going to give you a really, really cool app that even helps me as an agent figure out and navigate the Medicare mystery. Let's go. I'm going to start with is the infamous question, Alyssa, does Medicare cover dental? Does Medicare cover vision? Those are the top two things that I hear all the time. So I want to help you figure out what Medicare does and doesn't cover. But as always, and as promised, I'm going to do it to a point where you can access. It's no point in showing you on my systems and agent side, because I am a broker if you're new to Medicare Media. And by the way, if you do need a full length, you're turning 65, you need to know what your options are, an intro to Medicare, if you will, even if you are on Medicare and you just maybe need to brush up on what kind of plan you got. Then down below, there is a link to a full length free Medicare 101 webinar. I do run them every week in addition to these videos. So that's in the link below. But let's get back to what you have access to is Medicare.gov. Medicare.gov is a great spot for education, not only for the client, but heck, I use it all the time. There's all kinds of questions you guys are bringing up that I'm like, you know what? I never thought about that, but it's always found in Medicare.gov. Not to mention that book, Medicare and You probably get it sent to you every year. And if you're about to turn 65, you're going to get a book about this thick called Medicare and You. You don't want to just level out your coffee table with that or use it as a seat for your kid in the booster seat to plump them up a little bit. That's not what you want to use that for. Do keep it as reference. So let's get into Medicare.gov, and I'm going to show you where you can find what's covered and what's not covered. Okay, here we are in Medicare.gov. This is the homepage whenever you just type in Medicare.gov, and I'm going to go to right here, the providers and services, and then go to what Medicare covers. Now, this is a great spot to start. It'll give you a brief overview of what A covers, what B covers. And then here's this tab here, what isn't covered by Medicare or by Part A and Part B of Medicare. I like to start here, pure preference, because the list of what it doesn't cover is a whole lot shorter than the list of what it does cover. And I'll actually, right here is where you go to where it does cover. But let's just kind of hang out here. And I want to point something out. Up here, it says Medicare doesn't cover everything. If you need services, Part A and Part B doesn't cover. You have to pay for them unless, don't blow by that, unless you have other coverage, including Medicaid. So not to get Medicaid mixed up with Medicare. So there is the definition of Medicaid. So if you ever wonder if they're the same, yes, they kind of sound the same, but Medicaid just is for low income, and it does vary from state to state. So you will have to call your state office for that, see if you qualify. So onward. Or if this is where most people are, or if you're in a Medicare Advantage plan, like it says here, is also known as a Part C plan that includes your A and B benefits, but also includes other items like these listed below, because it's offered by the insurance companies. So the United Healthcares of the world, the Aetna, the Blue Cross Blue Shield, the WellCare, you name it. Go to Medicare.gov, you type in your zip code, and boom, you'll see the thousands of Medicare plans in your area. So those individual insurance companies offer Medicare Advantage plans that do come with some of the extra benefits, like fitness programs, vision, hearing, and dental, that Medicare sure as heck does not cover. The government is not going to cover for your fitness. Although, I don't know, I think that'd be pretty cool if it did. So let's get into this. Long-term care, and this is, I'm not going to sit here and read it off. You can read for yourself, navigate to Medicare.gov and poke around and look for yourself. But one of the items I'm going to hang out on is dental, being dentures, being, like it says here, most dental care. And I'll tell you why it says most dental care. So dental is covered by Medicare in the form of, like, you had an accident and you need some dental work done. So the cleanings that are recommended yearly, I think the dental association probably says 2 times. Some people go 1 time, some people go 3 times. Either way, doesn't matter how many times you go, cleanings just aren't covered by Medicare. You can think of it in a way like this. It's actually, I don't know what Medicare is thinking when they say, yeah, we got your medical, we got your doctor visits, but I don't know why they left out dental. That's woohoo, above my pay grade, or I guess I'm too far away from uh, the capital to make those kinds of decisions. But dental's just not offered or not covered by Medicare. What you can do is, remember, you've got original Medicare where dental isn't covered. And then if you go the Medicare Advantage route, think of you turning in your Medicare card and then you receiving a Medicare Advantage plan from the company. I say turning in the card because the Medicare Advantage plan then becomes your primary care. Now, because the insurance company now becomes your primary care because they're the Medicare Advantage plan, they're going to take care of your A benefits, your B benefits, but because they want your business, they're also going to offer things that Medicare doesn't cover because they can, because they're insurance companies. So they're going to offer you dental benefits, or also known as like dental allowances. Think of like the allowances that you used to get as a kid. Dad says, mom says, $50 a week, whatever an allowance was back in your day. I don't know. But think of them saying, all right, here's a $2,000 allowance. Dental plans are anywhere. I've seen $500 annually to I've seen $5,000 annually. It just depends in your area. So imagine this allowance and you're going to get your cleanings, your dentures, your partials. So less and less companies are covering implants. Implants are getting harder and harder to cover. They're expensive. It's an expensive benefit. So not a lot of insurance companies offer that anymore. So just check your plan. Now, so Medicare Advantage plans come with these allowances. If you go the Medicare supplement route, and it says so you've got original Medicare as your primary, you've got a Medicare supplement plan G, plan N, whatever it is, you've got your drug plan next. And I talk about them in these levels because this is also the way in the order that you would show to a medical provider. So you go to the doctor's office, you're going to give them first your red, white, and blue card, and you give them second your Medicare supplement card, third your prescription drug card. More than likely, you're bound to be prescribed a drug if you go see the doctor, if it's anything outside of maintenance. And then the last one is your dental and vision plan. It's a private plan, no different than if before. you were 65, maybe you're self-employed and you had to go buy your own dental vision plan that's like outside of group insurance. That's essentially what you're getting if you go the Medicare supplement route. So you'd be purchasing a $1,000 benefit, a $2,000 benefit. They usually go from $1,000 to $5,000. It's usually no waiting period. That's what you want to look for in a dental plan. So real quick, things you want to look for in a dental plan: no waiting period. You want to look at immediate coverage on major services. So somewhere in the 20% the first year, and maybe 50 to 60% years 2 onward. You want to look for that. Vision is something that sometimes it's offered as a rider, sometimes it's built into the plan. But as far as looking at a dental plan, you want to look at, I always say this, what you're currently doing. If you go see the doctor or the dental, get your teeth cleared once a year, then you probably don't need such of a big benefit. But if you're the person that says, Alyssa, hey, later down the road, I may need some dentures, I may need this down the road, then you understand what you are buying, which is insurance you're going to pay today to maybe use it down the line. So that is mainly the sum of where dental is at in the Medicare world. Now, if you don't have a Medicare Advantage plan, you don't have a Medicare supplement plan, all you have is original Medicare, your red, white, and blue card, and a drug plan, then you just have to self-pay, cash pay your dental, which some people do. It's an option. It's not a recommended option to go, I say to ride bareback. That's what I feel like, just having original Medicare with no supplement, no Advantage plan, just original Medicare is like riding a horse bareback. I don't know, driving down the highway without a seatbelt. Like that's what I see. And that's my personal opinion, because of the high deductibles and the no cap coinsurance on Part B side, which is why you should enroll in a supplement or an Advantage plan. Anyways, another video, but let's talk about the next thing. The next popular topic is vision. Everybody, at some point, I feel like, my dad, he's now 70, about to be 73 this year. He's never had vision problems. He's had 20/20 vision. Now all of a sudden he's needs some prescription glasses. Well, on his plan, he's allowed I think a $300 benefit every year. And so he can go get his eyes checked. He is on, don't ask about his plan, by the way, it's a retiree plan. So, but these benefits are very similar in Advantage plans. There's $150 to $300 for your frames every year. And then you get a eye exam covered. With just original Medicare, just like you saw on the slide, it is not a covered service. Now, it is covered in the midst of an accident. So when it comes to cataracts, this is also another hot topic. Cataracts do fall under Part B, as in boy. Then if you're on a Medicare supplement, your supplement plan would pick up the 20%. If you're on an Advantage plan, check your Advantage plan. Most of the times it's 20% coinsurance, just because it's a pretty expensive surgery. But on Advantage plans, they give you most preventatives at $0, so you can I don't know if you can prevent a cataract, to be honest, but most of the preventatives, that's how the Medicare Advantage plans works. They want you to get checked out. They want you to get looked at. So the surgeries are at a lower risk to the company. Anyways, that's how it works. So let's get back into that screen. Here we go. Okay, so we covered dental. We covered eye, dentures, yes. Cosmetic surgery. I mean, I wish that'd be so cool. But it's so expensive. Okay, massage therapy, things like that. Now, I have never seen massage therapy on an Advantage plan. Could be wrong. Please type in the comments if your plan includes that. Chime in. I know the routine physical exams definitely are for dental, vision, hearing in an Advantage plan, right? So most of these, my point is most of these are included in an Advantage plan. Long-term care is not. Okay. If you're listening to this and you're thinking that your coverage is going to help you in a long-term care situation, look into a policy. That's all I can say there. A standalone policy, private policy. So hearing aids. My dad needs hearing aids. If you're watching this, Dad, wait, you do. So they're also not covered, but they're in Advantage plans. So it's the same thing. You'll see a hearing aid copay of anywhere between $99 to maybe $17.50 per ear per year. That's how it is, per ear per year. So you can get one aid per year, which works out. Most people's ears go one at a time, not two at a time. But again, check the plan in your area, which is a little bit of a discount because hearing aids are anywhere between $3,000, $5,000, and I've seen $7,000. So a pop. That's a pop. So concierge care, also not included in original Medicare or with a Medicare supplement. You can count on these things. If you're in a Medicare Advantage plan, some of these things may be in a Medicare Advantage plan, which is what makes them so valuable to seniors these days, because you can get a whole lot more for your buck. With a Medicare supplement, it does, yes, provide you very robust coverage as a secondary coverage, but it does not include any of these things. So these are going to be standalone plans or out-of-pocket payment if you're on the Medicare supplement side. So now so if you're the person that's like, well, I want to see if my, my fill in the blank is covered. You can do that here. And before I get into the takeaway that I said in the very beginning, I'm just going to show you this list of what Medicare does cover, just so you can see where it's at. All of this is what Medicare covers, and they summed it up in basically one page. I think one page. Yeah. This list shows many, but not all. Okay, so this is probably the most common things that people ask about. And yes, you can click on it. All right. Now, what I do want to show you, and what's going to pop up here on the screen in a little bit, is a picture of the app that you should download. And I say this because I get this all the time from my clients. They're like, hey, sorry to bug you. I know, we spoke 2 months ago and my plan's good, but I just want to know, is this covered by Medicare? And so most of the times what I'm sending out is just a link to download the app. So it'll look like this. And Android can download it, iPhone can download it, but it's really neat because you can have that on your phone. Most seniors these days have phones with them. And, if you're sitting there wondering, hopefully not sitting there in the doctor's office wondering if it's going to get covered, but if you're at home and you're thinking about something that you want to get done, hey, does Medicare cover it? Then you can type it in there. Now, just because Medicare covers it, if you are on an Advantage plan, you need to check that particular, let's just say, for example, a shoulder surgery, maybe a scope, because you got maybe some frozen shoulder. You need to check that within the Advantage plan. It may say outpatient surgery. You want to circle that copay, maybe $150. There's probably going to be a specialist visit in there, so that's probably another $30. And so that's how you start to add up the cost and kind of estimate what your surgery is going to be. If it is, if you are on a Medicare supplement and you say an outpatient surgery is definitely covered by Part B, because remember, A is inpatient, B is outpatient. So you're going to see a specialist, you're going to get a surgery, you'll probably need some physical therapy. So, and the same thing on the Advantage plan side, there's physical therapy has its own little price list. So on the Medicare supplement side, you need to hit your yearly deductible, which we're in 2024, it is $240. You'll hit that and then keep paying your monthly premium because everything else is covered by your Medicare supplement. So if it says cover and in the app what's covered, if it says that it's covered by Part B, if you're on a Medicare supplement, that's a great thing. That means your supplement will pick up the rest that Medicare does not. Now, that is the application to help you out, keep in your pocket, save it for a rainy day. Stay tuned for more helpful videos. My name is Alyssa. This is Medicare Media. Again, check out below the full-length webinar, comment, but absolutely, if you got any value out of this, like, subscribe, shoot me a message, get a hold of me. That's all for now.